Can you introduce yourself?
My name is Kae. I use she, her pronouns. I am an incoming pediatrics resident at the University of Vermont, and previously was a medical student at the University of Vermont, and hope to be a pediatrician that works to provide gender-affirming care for youth.
What sparked your interest with working with queer youth and supporting them?
Well, the biggest thing is that I'm trans, and just through my journey of transitioning and finding the supports that made me feel the best in my own body, I really felt like I wanted to give back to all the people that supported me. So I ended up getting this fellowship through the University of Vermont Medical School to work specifically with Outright to host these little chalk talks about different modes of ways to just affirm your gender. So we had a little chalk talk about IDs, had another chalk talk about tucking and binding, another one more specifically about the medicine. And through all of these, I just fell in love with this word even more because I just saw how genuinely happy youth were when they were affirmed, and that happiness is just so infectious and making me want to continue this work in the future.
Okay, do you believe access to gender-affirming care will be affected in the near or far future?
Well, I think that access to gender-affirming care has been affected already. Just backtracking back in January, Trump had this executive order talking about how he wants to end gender-affirming care. If you step back and think about what an executive order is, it's just a presidential wish list. He's just writing down what he wants to see happen, and it's up to Congress to pass something, and it's up to the states to pass something. But in the Constitution, there are a lot of rights for states, and they can't specifically infringe on those rights without consent from those states. So here in Vermont, our leaders have really strongly wanted to advocate for keeping gender-affirming care for youth. I was talking to the Vermont Medical Society, which is a group of healthcare workers / lobbyists that work with the Vermont legislature, and their official position is that gender-affirming care is healthcare. So banning this is going to cause so many bad things for you. It's supported by all the evidence that we have. So I think that at least in Vermont, we're going to continue doing things the way that we have. The pediatrics department at UVM has also said that they're going to continue doing gender-affirming care unless somebody from the government literally rips away their ability to write prescriptions, because this is very much grounded in the evidence that we have. Unfortunately, in other states, either institutions have just stopped providing gender-affirming care because they're worried about the lack of funding they're going to get, or full states have banned it. So it's very different based off of where you live, and that's really unfortunate because I think that everybody should have access to the care that they need.
What do you wish more people knew about gender-affirming care?
I wish that people understood that you can't just use therapy to make people stop being trans. Being trans is an innate part of who people are, and oftentimes the negative like psychological consequences like depression, anxiety, eating disorders are a result of society's expectations and how society doesn't accept trans people, trans youth for who they are. There are just so many studies out there that say that when transgender youth start hormone therapy that aligns with their gender, they have like rates of depression, anxiety, eating disorders very similar to that of a cisgender population. And there's a lot of evidence saying that like purely therapy like doesn't work. There is like mixed evidence about like social transition. If it's social transition and like hormone therapy that aligns with what youth wants, then they have like better mental health outcomes than somebody who is socially supported but isn't supported medically. I was working with, I think they were like a high schooler at the time, but they had like this long history of an eating disorder that just like never went away, and it got to the point where that they had to go to a facility in North Carolina. Vermont doesn't have great eating disorder care, so they have to go like all the way to North Carolina, which is a red state. And they weren't out as trans, but once they came out, their parents started bringing them testosterone like across like state borders. And within like a couple weeks, they were like good enough to leave the facility. They were like at the facility for like many months. It might have been even like over a year. And then like talking to them at the appointment, like a couple years after that incident, they're just like so happy with who they are. They're doing all these great things at school. They're getting great grades, looking at some of the like top colleges. So it's just like really incredible how support from family, support from medical providers can really like change someone's like trajectory.
Are there any myths about gender affirming care that you would like to dispel?
Yeah, I think that one myth about like gender affirming care is that like this is like a way to like sterilize like an entire population, and that makes like a lot of people really scared and hesitant about it. And there is like a very little bit of truth to that. With like surgeries, you may not like be able to like reproduce in the future, but before like you start gender affirming care, there's often a very like long discussion about like fertility preservation. They also talk about like what kind of goals like you have for your body and what makes you feel like good about yourself. And sometimes those goals don't involve having like children in the future. Sometimes they do, and depending on those answers, hormone therapy can be tailored. It can be like no hormones, it can be like low doses of hormones until like, I want to make this like decision. There are like trans masc folks that can like carry babies. And I know like quite a few trans masc folks that have had babies. So it's not like something that like fully like sterilizes the entire population. And just like a discussion that like youth, parents, and like medical providers like will be having, because if that is like a value that's like really important to you, that should be like worked out And that was a conversation that I've seen like physicians and like other providers have with their patients, because it is really important for a lot of people.
Do you know of any accessible gender-affirming resources you can recommend to youth who may not have access to other ones?
Yeah. First and foremost, Vermont is a great resource. They have all sorts of like different clothes for folks. They have like resources about like safe tucking and binding, and also they have binders and gaffs, I believe, and also other gender affirming like undergarments. So like anybody who wants to like try out some clothes can come to Outright Vermont to try those on and see how they feel in them. I think that one of my favorite like ways to like get gender affirming resources for myself is either like finding like another like trans person who's like getting rid of like their clothes that don't match like their gender identity, and they're like, I want to get rid of all of these, and I'm like, yes, I'll take all of them. One of my favorite things to do, or often like my cis friends like also want to get rid of their clothes, so getting free clothes from them have been really, really great. And then in terms of like just resources about gender affirming care in general, the UCSF website has some great bullet points about like what transition can look like. The Transgender Youth Program here at UVM also like sends out like pamphlets, and there are like ways that you can like schedule an appointment with them. They can talk to you about like your options.
What are some ways youth can advocate for themselves in medical settings, specifically in relation to getting gender affirming care?
Yeah, that's a really, really important question. It really depends on like where that particular young person is at. Are they in a place where like it is safe to transition? Do they have like support from any adult? So I think the first step is to have a trusted adult, whether it be a parent, whether it be like a teacher or a school counselor, to like be able to like either bring with you to an appointment or to talk about an appointment with them. And oftentimes they may have resources about like which providers are gender affirming, because if you like go to a provider that is not gender affirming, that would just really suck, because you're there wanting to get care, but they either like don't know or they're against it, and that's super, super scary. I know that here in Vermont, our Transgender Youth Program up at South Prospect Street, even like the outpatient clinic there, do a really good job at training like all of the providers to be gender affirming. Many medical students and many providers have worked on programs to like update the intake forms so that like your pronouns are collected and your name is collected, and folks at the Transgender Youth Program will also like ask you like at each visit, like, have your pronouns changed? Have your goals changed? Has your name changed? Things like that. But I really think that like finding the people that will advocate for you is really, really important, because it's gonna feel really like unsafe otherwise.
You've been on the med team at Camp Outright. What was it like working with queer youth in that setting?
Yeah, I really, really enjoyed my time at Camp Outright. I've never like seen so much like queer joy and like one place. It felt like almost like this community that was completely gated from the stresses of the world. And like you could tell that like a lot of the counselors, a lot of the youth had been through quite a bit. But like existing in that space, they were all just so happy to be themselves, to try out different names, to try out like different pronouns, to just like exist in a setting where they didn't have to hear about all of the bad things happening, didn't have to put up with bullies that didn't affirm them. And yeah, it just felt so special to be there. And I felt like I learned a lot from the youth, because they would like tell me like how they like viewed their own gender. Like one of them was talking to me about like how they viewed like gender as like banana bread, and I was like, whoa, like what does that mean? And they're telling me that like banana bread is like, is it bread or is it cake? And I'm like, I don't know, like does it really matter? And they were like, exactly, it doesn't matter. You can just be banana bread, and doesn't really matter like what category you're in. It's just the category that you want to be in. And I'm like, that's so amazing. So yeah, I really, really enjoyed it.
Could you share any other moments of queer joy working with queer youth?
Yeah, there was towards the end of camp last year, I was like sort of called out to like just talk with one young person about like how they were feeling. Wasn't totally sure like if this was like fully medical or if it was like something else. And they were like just straight up telling me like, I am done with camp for like this year. And I was like, oh, tell me like more about that. And they started like just going on about like how grateful they were for everybody there. But they just knew that like their time had come, that like they just felt like really overwhelmed. But they felt really happy that they made it to like the second to last day. And that all these people who like genuinely cared for each other, they wanted to take that and bring it to the community that they came from, because the people there weren't nearly as like supportive as what was here at camp. And just like listening to them just sort of like just list off like all the things they're going to teach their community, I was like, what? Like I didn't realize that like these little things that we've been doing have made like a world of a difference for some of the people that we work with. So that was really, really great.
Finally, do you have any words of support for the queer youth watching?
I would like to say that like, even though like everything seems really, really awful right now, and it may not seem like people want to be like as supportive as they were like a few years ago, I think that this will be temporary. We've seen like multiple times like in history where like there's just been like this rise of like fascism, and that always crumbles. And it usually crumbles pretty fast. So what I'm like really hoping to see, and what I'm like willing to bet, is that like things will get better really, really soon. And our community as a whole is really, really strong. We're always here for each other. We've been through like some really, really like hard times in history, including like right now, but we're just so resilient. And just like remember that. Affirm like the people like around you who are struggling. Affirm yourself. Give yourself lots of hugs. Because like all of the bad stuff, it'll go away soon, but it is really hard.